Welcome to Raaonline. Today's topic of discussion is muscles of mastication, mandibular nerve, Otic ganglion and Chorda tympani nerve. The competency of this topic is describe and demonstrate attachment, direction of fibers, nerve supply and actions of muscles of mastication, mandibular nerve, Otic ganglion and Chorda tympani nerve. The muscles of mastication are mainly involved in the movement of mandible at the time of mastication. They are divided into principal muscles and the accessory muscles. The principal muscles are Temporalis, Masseter, lateral pterygoid and medial pterygoid. The accessory muscles are suprahyoid muscles and infrahyoid muscles. So in this picture we can see the principal muscles. Temporalis is present in the temporal region, that is in the temporal fossa, and the lateral pterygoid, medial pterygoid are present in the infratemporal fossa. The Masseter muscle is present in the face, that is the deep muscle of the face, which is deep to parotidomasseteric fascia. We will see what is this later. These are the accessory muscles. Accessory muscles are suprahyoid muscles and infrahyoid muscles. In this picture we can appreciate the anterior belly of digastric and posterior belly of digastric and the mylohyoid muscle. Deep to this there is a geniohyoid muscle. In the face there is a buccinator, but here the fibers are buccinator are not seen very clearly. And these are the infrahyoid muscles, that is below the hyoid. In the superficial plane we can appreciate this infrahyoid muscle from the sternum to the hyoid. This is the sternohyoid muscle. In the deep plane we can appreciate two muscles. This is the sternum to thyroid, oblique line of thyroid cartilage. From the sternum to the thyroid, sternothyroid. From the thyroid cartilage to the hyoid, this is the thyrohyoid. As well as we can appreciate this long muscle. This is the superior belly of omohyoid. And this is the inferior belly of omohyoid. So these are the accessory muscles. Today we are going to discuss the principal muscles of mastication only. Let's see the characteristic features of principal muscles of mastication. So all the principal muscles are located in and around the infratemporal fossa, and the insertion is in the ramus of the mandible. The nerve supply, all the muscles are supplied by the mandibular nerve from its trunk or from anterior division. The main action of these muscles are movement of the mandible on the temporomandibular joint, as well as the muscles are derived from the mesoderm of first pharyngeal arch. So these are the muscles of first arch. Nerve of first arch is mandibular nerve. So these muscles are supplied by the mandibular nerve. Let's see temporalis first. Temporalis is a fan-shaped muscle which is present in the temporal fossa. So the origin is the floor of the temporal fossa, as well as the fascia covering the temporalis is the temporal fascia. So origin from the bone as well as fascia. And the insertion is, see the direction of the fibers. These are the anterior fibers and these are intermediate fibers and these are posterior fibers. So the anterior fibers descends vertically, the intermediate fibers runs obliquely and the posterior fibers mostly horizontal in direction. All the fibers converges near the arch of the zygomatic bone and forms the tendon of temporalis. So this is this white colored thing is the tendon of temporalis. This tendon of temporalis descends deep to the arch of the zygomatic bone and attaches in the coronoid process. In the coronoid process it attaches in the tip, medial surface and the anterior border of coronoid process. So this is the origin and insertion of temporalis muscle. So the nerve supply is from the anterior division of mandibular nerve by two deep temporal nerves, supplies us the muscle from its deeper aspect. And the main function is elevation of the mandible, but the posterior fibers makes retraction of the mandible. This is the only muscle produces retraction of mandible. So that's all about the temporalis. Let's see the masseter. So masseter is the deep muscle of the face. It is a quadrilateral in shape. So the fibers are arranged in three planes: superficial, intermediate and deep plane. So origin is above, this is the origin, that is a zygomatic arch, and the insertion is below, that is the ramus of mandible near the angle. So the direction of the fibers is downwards and backwards. The origin is from the lower border and the inner lip of zygomatic arch. The insertion is lateral surface of the ramus of mandible. So the nerve supply is from the anterior division of mandibular nerve. So here we have to know some important features regarding the masseter. It is a muscle of face, but it is a deep muscle of face, but it is not a muscle of facial expression. It is a muscle of mastication. There is no deep fascia in the face except in this region. The deep fascia is known as parotido-masseteric fascia. Parotido-masseteric fascia is derived from the investing layer of deep cervical fascia. So near the angle of the mandible, the investing layer splits into two lamina. That is, the superficial lamina goes upwards and blends with the perimysium of the masseter and attaches in the zygomatic arch. So deep to that fascia, the masseter is present. In the anterior border of the masseter, there is a course of facial nerve from the cervical region to the face. So the facial nerve turns from the neck to the face in this region. So the anterior border of the masseter. So this is known as antero-inferior angle of masseter. So in this antero-inferior angle of masseter, we can feel the pulsation of facial artery. So these are some of the important points regarding the masseter. The action is it elevates the mandible as well as protrusion of the mandible when both the side muscles contract together, as well as side to side movements when the both sides acts alternatively.